This week, we uncover why your doctor might not have your best interests at heart. But first, we expose the shocking truth about early intervention that hospitals don't want you to know. Is waiting until you're sick to see a doctor one of the biggest mistakes you're making? You don't want to miss it. Welcome to the Brian Nichols Show. Instead of focusing on winning arguments, we're teaching the basic fundamentals of sales and marketing and how we can use them to win in the world of politics, teaching you how to meet people where they're at on the issues they care about. Welcome to the Brian Nichols Show. All right, and with that, returning to the Brian Nichols Show from the Wellness Company, CEO Peter Gillooly. Welcome back to the show. How you been?
Hey, Brian. Thanks for having me back. I've been great. Enjoying the summer.
You've been great, but I'm sure you've been busy. I mean, we're getting ready for, Q3, Q4 of a bunch of exciting uncertainty.
Yeah, to say the least. I mean, I think we all knew 2024 would be a little bit of a roller coaster of a year, but I don't think any of us thought that we would see quite what we've seen between wars and pandemics and assassination attempts. I mean, we're barely just over halfway through.
And that was just the summer. So, yeah. Little bit's been on the radar here, but Peter, let's do the audience a favor. Since the last time you were here on the show, we've seen the audience numbers grow leaps and bounds. So there's a lot of folks in our audience who maybe aren't super familiar with the Wellness Company. So before we dig into our topic of conversation today, do us a favor, reintroduce the Wellness Company. Who is the Wellness Company? Why do you guys exist? And all that therein. Peter, the floor is yours.
Great. Thanks for the opportunity. So if you've never heard the Wellness Company, welcome. So we are the fastest growing telemedicine company in the nation. We were founded just over 2 years ago with Dr. Peter McCullough, who many of the audience might know. We were founded originally to be a safe harbor for all these doctors that were disenfranchised during COVID. So many doctors like Dr. McCullough, lost their livelihoods because they tried to speak up for scientific fact and medical truth. And it's kind of a strange reality to cope with, Brian, but that's just what happened to the most honest members of our medical establishment over the past 5 years. So we found the Wellness Company to practice health and medicine as it's meant to be practiced. That puts the patients first. We offer doctor-designed supplements that offer some pretty unique benefits that you're not going to find with your kind of typical Chinese crap that Amazon sells. And we offer prescription medical emergency kits that we prescribe prophylactically to customers that have life-saving medications like ivermectin and hydroxychloroquine, the things that they withheld from us during the pandemic because they knew it would have been safe and effective.
How dare you give your patients horse dewormer, Peter? What are you doing?
The horror.
The horror indeed. And by the way, I just want to go back to a statement you said there. The way that medicine is supposed to be practiced. And this is where, man, Peter, like a lot of my audience, I mean, yes, we are political in nature here, but a lot of the folks in my audience are very much politically either agnostic or homeless. And the recurring theme I see whenever I do my audience surveys is that for that politically homeless, agnostic individual, they're very much in a situation, they're looking at the world and they're saying, whatever's happening, something's broken. Stuff ain't working the way it's supposed to. And for a lot of folks, Peter, this is the moment for them where they're, to use the Matrix analogy, right? They've taken the red pill. They're waking up. They're seeing things for the first time that they cannot unsee. And to those folks, they say, okay, I acknowledge the elephant in the room. The system is broken. But now what? I've lost my trust. I've lost my healthcare. I've lost my economics, my finances. Everything seems to be broken. Where do I turn to folks who I can trust? Now, there's a reason you guys are a sponsor here for the Brian Nichols Show. But I would just love if you could just paint that picture in terms of, you talked about how healthcare is supposed to be. How did we get to a point, Peter, where it took you guys coming to fruition back during the insanity of COVID to literally just being the entity out there who's doing the healthcare the way it's supposed to be done? How did we get to a point where our government healthcare or government-backed healthcare systems have just dropped the ball so badly?
Yeah, it's a great question, Brian. And I'll first preface this by saying, I can definitely relate to everything that you just said about your audience. I mean, the things that I thought were conspiracies 10 years ago, I've now more or less turned out to be true. And even if you told me 5 years ago that we would be doing what we're doing now at the wellness company, I would have said, there's not a market for that. Like, why does anyone need that? But like, lo and behold, here we are. And I think it comes down to the fact that there's been this great perversion in how medicine has been practiced. And it really starts with that doctor patient relationship. That used to be sacred. It used to be none of anybody else's business between what a patient and a doctor do. It's their agreement to come up with the best course of treatment for their condition. And that was that. But kind of over the last few decades, we've seen so many third party influences start interfering and modifying that patient doctor relationship, be it hospitals, medical schools, insurance companies, big pharma, the government. They all have their hand in the pie here, and it's led to some very, very bad health outcomes to a lot of Americans. It starts at med school. So, first of all, in med school, the training that doctors get is a little bit odd if you think about it. I mean, take something like vaccines, which has been in the headlines now basically nonstop for the past 5 years. Med school is lucky if they spend one full day on the topic of vaccines with medical students. And, keep in mind about
What?
the amount of focus that we give on vaccines.
I was just going to say, we just spent 4 years going through, if you don't get vaccinated, you're the worst person in the world. They take 1 day of courses. Holy hell.
It's pretty much it, right? And I mean, so they spend their time learning about types of medicine that just really aren't relevant or germane to the experiences of many Americans. They graduate med school, Brian, and they effectively have $500,000+ of debt. And it's not like a mortgage where you can sell your house and get out of the debt if you need to. This is debt that needs to be paid off, right? So what do? They go work for a hospital, and they have to do what the hospital says, or they don't get paid. There's no other option here. So I don't want to say they're enslaved, but in a way, like, they're operating now within a system where they've lost a great deal of their autonomy to do what's best for the patient. So suddenly they're working for a hospital. The hospital gets paid by the insurance companies. The insurance companies then need to assign a billing code to every single patient encounter to standardize care. So that's why you hear in hospitals, they talk about billing codes and codes all the time, code. It's all about assigning the most profitable insurance reimbursement to a specific condition.
Hey folks, I want to take a moment to talk about something that has truly changed my life, and that is Cardio Miracle, our incredible studio sponsor. Now, I'll be honest, when I first heard about Cardio Miracle and their claims about improving heart health, I was skeptical. But after using it for just about 2 months, I was absolutely blown away by the results. First, my blood pressure went from being consistently around 140/90 to a much more healthier and manageable 120/80. And my resting heart rate dropped from the low 70s to the high 50s. And I couldn't believe it. But the benefits didn't stop there. I started sleeping better, and I felt more energized at the gym, and my heart felt the best it's felt in years. And it's not just me. Hundreds of you, our amazing listeners, have reached out to share your own incredible experiences with Cardio Miracle. So, what is Cardio Miracle, and how does it work? It's a carefully crafted supplement that harnesses the power of nitric oxide to support optimal heart function. So, by increasing nitric oxide levels in your blood, Cardio Miracle helps relax your blood vessels, improve circulation, and it protects your heart from damage. It's like giving your heart the support it needs to function at its best. And here's the best part. We've got an exclusive offer just for you, our loyal listeners here at the Brian Nichols Show. When you head over to cardiomiracle.com and use code TBNS at checkout, you'll get an extra 15% discount on your order. Plus, with their 100% money-back guarantee, you've got nothing to lose and everything to gain. So, if you're ready to take control of your heart health and experience the life-changing benefits of Cardio Miracle for yourself, just click the link in the show notes or video description. Trust me, your heart will thank you. And don't wait another day to prioritize your health. Join the tens of thousands of folks who have already discovered the Cardio Miracle difference. Head to cardiomiracle.com now and use code TBNS for 15% off your order. Your journey to a happier and healthier heart starts today. And now, let's get back to the show.
And that condition, or the insurance code, often misses a lot of the nuances, Brian, a lot of the subtle things that can modify a treatment plan because they don't fit neatly within one code or another. But you're assigned a code that you're then billed out. Those codes are, of course, determined by big pharma. They're determined by the hospitals, which assign specific values to how much time a doctor can spend with a patient, right? I mean, you're lucky if you talk to a doctor for more than 5 minutes today in any encounter, and that's because they try to give most of the background information collecting, where really you get the most context about a condition, off to a lower level practitioner like an RN or something. And you end up, having people that are relying on their insurance to pay for their medical bills. And keep in mind, insurance, one of the greatest scams ever foisted onto Americans. Effectively, your paycheck is being garnished every single month. You think it's free. You think your doctor appearances are free, but they're not. You're paying thousands and thousands a year for maybe a 10-minute physical, and that's all that's really covered. You're going to pay usually an extraordinarily high deductible otherwise. And you're saddled with a situation where, because insurance covers every single condition under the sun, they charge outrageous amounts. It'd be like, Brian, if your car insurance covered an oil change or a scratch on the door. The prices would be astronomical, right? Because you would be billing everything through insurance all the time. When in reality, you save a lot of money by keeping things outside of insurance. So those are just some of the perversions that we've seen warping how medicine is practiced and how it's priced in America. And don't get me started on big pharma and the kind of treadmill of chronic prescriptions they put you on. But that's a whole other topic that I think a lot of Americans can also relate to.
Yeah, well, and let's just, I mean, we talk about, we try to, teach folks how to do sales here, and one of the things we talk about is unselling, right? So, like, Peter, help unsell to me. How do we get to where we are today? Like, what you just outlined sounds like common sense, not the current solution, but the way we should be going. So I guess help me unsell. How did we get to where we are today? Because if we can all just sit here and acknowledge that this system is inherently broken, that I am more than a number, that my audience is more than a number when they go to their doctor's office, I am more than a billing code. And with that, there's more to the healthcare industry than just insurance rates. So, like, how did we get here? And and by the way, I guess the better question, not just how we got here, why are so many people just like, it's the best we can do?
People, and I think the thing is, people take, Brian, the current state of health insurance as the doctrine. Like, they don't know that there's another alternative because they've not been presented with one. Yet these same people, I'm sure most of the audience can relate to this, will also agree that the government is not what you should be relying on for your well-being, right? I mean, I think Reagan said one of the scariest things you'll ever hear is like, I'm from the government
and I'm here to help. That's right. Yep.
Well, that is healthcare in a nutshell, right? And I think if Americans are entrusting a series of third parties who ultimately, Brian, don't care about their health or well-being for their future, they're going to be left in a place where they're going to be ultimately disappointed. I mean, we saw that for hundreds of millions of Americans during the pandemic, where they were betrayed or lied to or left behind or abandoned by a healthcare system that supposedly was going to put their interest first, right? So I think it's kind of a wake-up call to all Americans. If you weren't a prepper before, maybe you should start thinking about becoming one now, even in some small ways, and start taking personal responsibility for your medical decisions, because at this point, who can you trust? Right? It's certainly not the institutions. They've already proven what they're in for, and that's just turning you into dollars.
Why aren't there more companies out there like the Wellness Company who are identifying a very real problem in the healthcare industry? And I'm just going to say it, Peter, you guys wouldn't be in business if there wasn't a way to make some money, right? So you must be seeing some revenue coming in, some profit coming in that's allowing you guys to do what you're doing. But where's everybody else? Why is it? It's just a matter of it's easier to get the tried and true, I guess, method in place if you're in the healthcare profession, that going your route actually requires, I don't know, a little entrepreneurial know-how.
Yeah, it's two things. Number one, it's that if there's one thing that all the government programs and big pharma programs make easy, it's plugging into their system, right? So that's why you see even the smaller independent practices, they accept Medicare, they do all this stuff because it's a easy, more guaranteed stream of income. On the other hand, one of the big issues that we've seen time and time again is that there's just a very high cost of entry. So we operate a 50-state telemedicine practice. It took a long, long time to get all the registrations and all the filings and all the paperworks and all the lawyer fees together in order to get that practice up and running. But now that we have it, it allows us to practice medicine freely as we see fit because we built it ourselves. We didn't plug into all of these third-party payers that ultimately cause the problems.
Wow. Okay. So there's a lot there behind the scenes, I guess, that goes into building something like the wellness company. So then the next question, Peter, inevitably is, let's say there's doctors and nurses who listen to this show. I know there is. But let's just say they're listening today and they're saying, you know what, Peter, I'm pretty tired of working at my ABC institutional hospital name here. I really want to do medicine the right way. So like what is a course of action from the healthcare provider side of things? Because we see from the patient side of things, like, okay, call a wellness company or call folks in this world. But if you're a healthcare provider, I'm sure that there's a lot of angst. I mean, you go through, you get your certifications, your licenses, all that fun stuff. Do those all carry over? What's the cost of doing business, the barrier to entries beyond the stuff you outlined here today?
Yeah, I think from a healthcare provider standpoint, it definitely requires a leap of faith. And like I said, for a lot of medical doctors, I think there is a
If you think you're supporting small farms with your coffee choices, think again. Many brands hide behind fancy packaging while sourcing cheap coffee beans. So you need to stop compromising on quality and on ethics. Clockham Craft Coffee was born from a desire for both transparency and excellence in the coffee game. They personally select every bean, ensuring top quality and fair practices. So experience coffee the way it's supposed to be. Honest, delicious, and roasted with care. Plus, an exclusive offer for Brian Nichols Show fans. Use code BNS10 for 10% off at clockhamcraft.coffee. Link in the show notes. And now, let's get back to the show.
There definitely is a preconception by the public that these people are raking the dough. In reality, it takes doctors, I'm going to say between 15 and 25 years on average to be out of debt and earning at kind of like more senior rates.
Oh, that's it.
It's not. But keep in mind, like you're not even starting practicing as a doctor until you're in your 30s, right? So like, you're not the doctor. The sweet spot for doctor earnings isn't going to happen until you're probably close to 50.
Quarter century later, then you might see some money. We'll see.
Right, but that's how the system has been architected over the past few years because it really wants doctors to be reliant on these institutions because that's how these institutions ultimately get money. So it's all kind of built into itself to reinforce the outcomes that we're seeing now and today. If you're a consumer of healthcare services, which we all are, it pays for you to be more prepared. And I think one of the most important things that people need to recognize in that the medical establishment does not preach like it should, because honestly, it's not the most profitable, is if you want to stay healthy, Brian, one of the best things to do is to practice early intervention at first sign of illness. Now, they don't talk about this in hospitals. I mean, we usually, you and I'm sure you've probably done this yourself too. It's like, you're not feeling so great. You decide, hey, I'm just going to try to ride it out. I'm going to go to work tomorrow, right? I'm going to, suck it up, man up. Let's
I thought you were going to say you went to WebMD and you found out you have toe cancer or something, because that's definitely happened.
Not quite, but
okay.
the big issues that we see is that, if you want to avoid a hospital visit and serious medical bills, oftentimes the best thing you can do is to address sickness at the very first sniffle. Right? When you feel that throat tickle is to have medications on hand to be able to attack head on day one. It's that first 24 to 48 hours, which really are determinant of the rest of the course of the disease, whether it's going to be severe or not. And if you're not addressing it early, you're going to be in a much more sorry state. We've all had those weeks where we got the flu and we've been, lied low pretty badly, right? But if you had addressed it in those first couple hours, there probably would have been a much different outcome. So the medical establishment, they're not incentivized to tell you this or help you with tools that you could use to practice this, because they make their money when you come in the hospital, right? I mean, they want to keep those beds full. So, at the wellness company, that's really one of the things that we preach is that, look, we want to give you the medications on hand. It's a God-given right to have things like ivermectin and amoxicillin and Z-Pak in your medicine cabinet, just like you have Tylenol. It's so important. I mean, that's going to not only, potentially save your life, but it's at least going to save you a big hospital visit sooner or later. And that's going to more than pay for itself, no matter what income level you're on. So I think it's really important that Americans start kind of waking up and saying, maybe I don't need to be paying these outrageous insurance premiums. Maybe there's ways I can just insure myself against, the catastrophic, car crash type incident. And I can be more assertive and in control of my day-to-day health and disease. Because look, it's not a matter of if, it's when you get sick, right? And we want to prepare you for that time so you're ready.
So one thing you mentioned here, I want to bring this back up, and it's going to hurt some folks hearing this, but we kind of go into the understanding of healthcare when we're kids and we grow up, that this idea when you go to the doctors are the people who care about your health. They care about you, Peter. They care about me. They want to make sure I'm better. And yet, what we've heard today, and I think what we've all experienced in our lives, is that that's a great story we tell each other, but doctors, nurses, healthcare professionals, just like, I don't know, anybody else in the world, they're reacting to incentive structures, right? So totally. If they see the incentive structure to say, wait a few days before Peter gets sick, then he comes in, I'm going to make more money, versus Peter, just dude, take the Z-Pak, you'll be fine. Like, call over the phone. Yeah, you're fine. You have to worry about coming in. That's money that doctor's never going to see. So that's step one I just want to call out, is that like incentive structures are crucial here. But the other part that you mentioned, Peter, and I just want to emphasize this as well, is that this requires a complete reprogramming of how we approach healthcare. And this has been the knee-jerk reaction for every single person, is that I don't go see a doctor until I'm sick, until the sniffles hit, until the aches and pains start, versus being proactive, paying attention, and yes, starting to engage in those conversations before the fever hits, before the chills attack. Like we have to just completely redo the way that we talk about healthcare, and frankly, the way we teach our kids about healthcare, because when you're a kid, that's what you're taught. You go to the doctor when you're sick, not you go to the doctor before you're sick. So it's a complete reprogramming of the way we approach healthcare.
Brian, you're absolutely right. Incentives matter. And I think there's two different things that people need to be factoring in when they're thinking about healthcare decisions and advice from doctors. Yes, there are perverse incentive structures where doctors are compensated by big pharma in ways of bonuses for prescribing certain drugs or giving vaccines. I mean, the childhood vaccine schedule is a great example that, primary care physicians and pediatricians, they earn bonuses if they complete the childhood vaccine schedule on time. That's a well-established, documented fact. And we need to ask ourselves, why is that something that, they're paid out to do?
I mean, Peter, they're, at the end of the day, they're being comped just like I comp my sales team. Like, what? They're doctors. They're not supposed to be salespeople, but this is how we're treating them, or they're being treated.
Yeah, I completely agree. And, that's why there's only two countries in the world, Brian, the United States and New Zealand, of all places, that allow pharmaceuticals to be advertised on TV. And that's what's wrong with the incentive structure with medicine today. But, the other thing that people need to really understand is, not all doctors are evil that practice in doctors, but many are mistaken. And I think one of the things that people need to know is that when it comes to pharmaceuticals and drugs, there is so much data that's put out on these things, and it's too much information, in fact, for most doctors to be able to absorb and put into practice. So they rely on the cliff notes, right? This usually results in instances where doctors are recommending drugs based on scientific fact, but not the full scientific facts. And the example I'll give you is this. So, a good friend of mine, um, cancer survivor, she was looking at being prescribed this fancy drug that was going to help her during her recovery period. She foregone chemo. The doctor had told her, "Look, if you take this drug, it has the following side effects. It's going to be hard, but you have a 33% chance of you have a 33% improvement in your chances of survival in the next 5 years." I mean, great. Like, you're sitting there, you're probably afraid, you're in distress. That sounds, maybe that's a trade-off that you like to make. Who doesn't like being alive, right? Well, the question that she asked, well, wait a minute, doc, like, what are my chances of dying in the next 5 years? The answer was actually 3%. So basically, she was going from a 97% chance surviving to a 98% chance of surviving with all these side effects with this drug that's expensive and costly. So most doctors are not looking at the difference between absolute and relative risk, which is what I just described to you. And most people, when they're making medical decisions like this, they're not thinking about these ancillary questions that they need to ask because they're not taught to ask them. And doctors oftentimes aren't thinking about them either. And it's not really the doctor's fault per se. It's just that, the doctors, they're processing a lot of information. They're trying to give you a recommendation based on some data, but we really need to be mindful that there's a big difference between absolute and relative risk. It's very confusing for patients, especially when you're in distress. Which, let's be honest, when you're making medical decisions, a lot of the times you are in distress. You feel like crap. You're under the gun to make a choice, right? And that's when you really can't afford to choose wrong. So I think just having a plan and doing your research and knowing about these types of questions ahead of time could be a lifesaver. And a lot of Americans are just not trained or taught to think this way.
Attention, freedom lovers! I am excited to tell you about the new Xpat Money Summit that's happening this year from October 7th to October 11th. This is your chance to learn from over 40 experts about crafting your perfect Plan B, from acquiring a second passport to diversifying your finances offshore and investing in international real estate. Headline speakers include Liberty legends like Dr. Ron Paul, Doug Casey, and Scott Horton. And the best part, it's absolutely free to attend. Simply visit xpatmoneysummit.com to reserve your complimentary ticket. Don't wait. Secure your spot at the world's largest offshore event today. One more time, that's xpatmoneysummit.com. And now, let's get back to the show.
Peter, we're going towards the tail end of the conversation, and this actually goes a nice piggyback to where I wanted to go with this last question, because a lot of people, they don't really pay attention to this stuff until it impacts them directly, or it's election season. So here we are, we're recording summer of 2024. Election season is right upon us. Now, granted, we do have a new candidate, so that might change a little bit of this here. But with that being said, you look at healthcare policy, very little in terms of an actual discussion about healthcare policy. At least when Trump was running for election back in 2016, it was like, he's going to get rid of Obamacare and replace it with Trump care, I guess. And that never happened. But at least there was a conversation about what was going to happen and proposals. I'm not really hearing anything right now. Am I missing something? Is there stuff like at a secret healthcare Slack channel you guys are all sharing this information with? What's going on here with Trump, Harris, policy positions, healthcare? Hit us with it.
Yeah, there's no secret Slack channel on this one. There's been
I was hoping we're going to get inside access to that, but okay.
I'll keep my eye out for it, Brian. But
Please.
I think there's been an absolute vacuum of information on healthcare policy for the 2024 election by both candidates. The most we've been able to get out of either side is on the Democrats wanting to continue to bolster and reinforce Obamacare, which, objectively, if you look at the price trends over the past 10 years for Obamacare, it's been an abject failure. I mean, it has not made healthcare cheaper for anybody in the United States. If anything, it's just encouraged more high-cost health plans onto people and then put them in the healthcare system that I've been describing for the past few minutes. Trump has articulated that he wants to relook at drug prices. I think that was one of his big themes for his last campaign. I do think there's some credence there. We have seen a kind of wild degree of inflation when it comes to drug prices in Americas. And I know we've had wild inflation to begin with, but like to an excessive degree with drug prices compared with, groceries. So getting some rational price control on things like insulin and critical life-saving medications, I think is going to be a important first step. It's going to necessarily limit all these third parties who are each getting their beak wet along the way of these drugs, but better than nothing.
Peter Gillooly, CEO of The Wellness Company. Today's episode is not brought to us by Pfizer. Sorry about that. Check will not be in the mail. But maybe it's going to be in the Slack channel. I don't know. We'll see. Peter, if we had to go ahead and put a nice bow on today's conversation, I would love it if you would be so willing to do so, because granted, we talked a lot of stuff today in terms of incentive structures, in terms of redoing the way we teach about healthcare, and when to be seen, and also talking about a lot of like policy stuff behind the scenes that we're not really privy to. But let's just paint the picture for folks of what to expect. And you mentioned the 5-year prognosis for your friend there. Let's give the 5-year prognosis for the healthcare industry. Where do you see the healthcare in 5 years? And let's just try to keep it agnostic of who wins in 2024. But let's just say 5 years from today. So, Peter, we're sitting down August of 2029. Where are we from a healthcare perspective, and how do we get there?
Yeah, I honestly, I think the healthcare industry is going to become pretty bifurcated. And what's going to happen is there will be another pandemic. I think you can all rest assured on that. Now, whether that's bird flu, Brian, or some other animal-based disease, pick your name. We've lived through monkeypox and swine flu and bird flu and COVID or bat flu, whatever you want to call it. Lab-grown flus for all we know. But look, it's been very well established that, even the World Economic Forum, in a rare Freudian slip, said that COVID was the most profitable event in humankind. They probably were right. And because of that, I would not be surprised that there will be another pandemic declared, whether it's on bird flu or some other disease, just because it's profitable. There is a ton of people globally that will comply with crazy mandates that are totally nonsensical. And I think really, kind of looking forward, Americans need to decide, are you going to rely on the government, or are you going to be personally responsible for your health, just like you're responsible for everything else in your life? And I really hope that, the listeners of your show take that to heart and understand that, look, at the end of the day, no one is going to come to save you, right? We're all kind of left to our own devices. And that's why we're trying to start this trend for medical autonomy and give people the tools that they need and the education to make their own decisions. There's other companies out there that do similar things to what we do. I hope they choose a company like The Wellness Company when you're looking for your options. But at the end of the day, I just want Americans to be prepared and have their own stockpile, to be conscious of their health, to not only think about having prescription medications on hand, but what are you doing on a daily basis in terms of lifestyle changes to keep yourself healthy? So when you do get sick, you're going to minimize the impact it's going to have on yourself and your family. And I think we're really going to see over the next 5 years, a lot of people who have opted out in a good way of the traditional system and have found themselves a new way of receiving healthcare that not only is more effective, but ultimately cheaper. And what's there not to love about that?
I love it. We talked a long time ago, the idea of a GoFundMe government. I like the idea of an opt-out government. Let's go that route. I think that sounds more fun because, I don't want to pay for things that I'm not utilizing or things I morally disagree with. So let's start saying, I'm just going to say no, thanks, but no thanks. I'm going to go to a different route. And hopefully that route is somebody like The Wellness Company. And if that is the case, folks, you want to go ahead and check out The Wellness Company. Make sure you use code TBNS at checkout for a discount applied on your order. They have health kits. They have actual doctor's appointments. You can do telehealth, as Peter said. All that and more over at The Wellness Company. Very excited to have The Wellness Company as a sponsor here on the Brian Nichols Show. Peter, I truly thank you for your partnership. I also just appreciate you guys doing what you do, because we talk about leading by example here, and that's exactly what The Wellness Company is doing. So with that, thank you. Any final words for the audience as we wrap things up today?
No, I really appreciate what you do and what you stand for, Brian. I mean, you guys rock, and I really hope that the movement continues to grow. I think people are making the right choices.
Here. All right, folks. With that being said, Brian Nichols putting a pin in today's conversation with CEO of the wellness company, Peter Gillooly. We'll talk to you next time.
Thanks for listening to The Brian Nichols Show. Find more episodes at briannicholsshow.com.